insert it. So go ahead, okay? And sometimes it may not be the case because everybody's anatomy is different. Okay?
So you said OPS for unconscious patient?
Unconscious patient.
So the right side, it just goes straight in, and then the
Yeah,
left
bevel
side
up.
is when you're with the bevel up, and then the left side is where you have to turn it.
You have to turn it 180 for it to go all the
180.
way down.
Okay.
Yeah.
And then the indications for that is if they're semi-unconscious,
Semi-conscious.
semi-conscious, and what was the other?
Frequent sectioning.
Frequent sectioning. Okay.
Okay.
And then
And then to confirm placement, I mean, just because you put it inside, you still have to bag your patient, right? Especially if you have this. If this, you just have to make sure you have like equal chest rise, SpO2 is good, check all your vital signs to make sure that your patient's, good.
okay.
So those are easy. Huh?
Yeah.
Yeah. Can you go over the OPA again?
The OPA?
Yeah.
Yeah, so OPA is you size from corner of the mouth to mandible. Okay?
Okay.
This is a little too big, but and it's for unconscious patients. And then to insert it, you can insert it this way, and then as you insert it, just twist it, and then it goes down.
Okay.
You can also insert it sideways, and just make sure that when you insert it, that you twist, that the curve is following the curvature of like the tongue.
And what would be the contraindications for?
So somebody who's like semi-conscious.
Oh,
so
okay.
like we're semi-conscious, we're not gonna. So if they have a gag,
Okay.
So someone who has a gag reflex.
yeah, then this is not for them.
Okay.
They have to completely be unconscious.
And then for the NPA, that one, the contraindications are anybody that's had, what was it?
So basically, what you got to think of this one is you're not going to put this on someone who is unconscious, right? Somebody who's semi-conscious, because if you put this on somebody who's unconscious, then they're going to need something a little bit more, not advanced, but something that's going to open up their airway and keep it open. This is not going to work for somebody who's unconscious.
Okay.
And then since we use it for like patients who are frequent suctioning, just make sure that they don't have like any trauma, anything, in the face or in the mouth. So those are all contraindications. Like anything that's going to make this worse as you insert it. So, okay.
And then we just need to make sure that we lubricate the.
The NPA you have to lubricate, yeah.
Okay.
And
The distal end?
distal end. This one you do not lubricate.
Okay.
You don't need to. Okay. So make sure you just little lubrication goes a long way, and then
Okay.
and make sure you use water soluble, so nothing like Vaseline. So water soluble lubricant. Okay.
Okay, and then for the
So
LMA.
LMA. So what I'm going to ask you is indication. So this is an airway that we use for patients who are apneic, cardiac arrest, right? We want to maintain an airway, maybe like surgery. If they're having like a routine knee surgery or hip surgery. So I'll ask you indications, appropriate size. So I'll tell you, hey, your patient weighs 70 kilograms. What size would you use? And everything's on here. So it says 50 to 70 kilograms. It's a size 4.
Okay.
So just make sure you guys
So
look.
you're gonna give us the weight in kilograms. Oh, you're so nice.
So, and it's on here, So if I
Okay.
tell you, hey, your patient's, 40 kilograms, and you're like, okay, well, it's probably a size 3.
Okay.
And then it tells you here how much air you need to insert in your cuff, right?
Okay.
So I'll ask you, well, how much air does your cuff hold? And it tells you right here. Okay, so 30. And it should be about 60 centimeters of water pressure when you measure. Okay? And you're going to need a big syringe like that one.
Okay. And then so you check it, inflate it, and then you insert it, and that's gonna be the way that you insert it is just like that inward. Okay.
I always say the opening facing the lungs, right?
Okay.
And then which side do you guys lubricate? Do you remember?
The bottom.
Okay. And let's see. So I'm gonna ask you the size. I'm gonna ask you the weight in kilograms. You choose the size. Check your pressure, your balloon. Make sure that there's no leak. Okay. Make sure that you lubricate the posterior end. Okay. And then when you insert it, you can insert this And you want to hold it like this, kind of like a pencil, and then use that top hard palate to kind of guide you, and then just insert it all the way down until you feel resistance and it stops. Okay? You want to try it, Nandi? And just make sure that when you guys insert it, I need an end tidal CO2 to confirm, please.
Oh, there's one over
That
here.
one?
Okay. Don't do that.
I think this is too small.
Sometimes it just says.
And so you're gonna have to confirm placement.
What number or what?
That one's so tiny.
It's a baby one. Good job. Okay. So you're gonna have to, don't forget to attach your end tidal CO2, and then you're gonna have to tell me breath sounds. Breath sounds, you know, color change, right? It's gonna go from purple to yellow, and then we're gonna have to secure it with tape. Okay.
That's one way that you can kind of see where your total pressure is, right? So if you're kind of confused, is this taking into account or is it not taking into account?
Just secure both sides.
So you look at your total.
Okay, so we secure both sides.
Yeah.
I think last time I only did one.
Okay. And let's see. And then just monitor your patient.
Okay. And then the indications and the contraindications.
So indications would be like apnea, cardiac arrest, respiratory arrest. Contraindications, I mean, they don't need any airway, right? Or if they have any, like a lot of teeth that are broken or lacerations in the mouth, then
Oh, okay.
we may have to do like an emergent trach.
Oh, okay.
Okay? All
Awesome.
right. And
So in a real world, you're neither bagging or taping.
yeah, you have to tape. And this is, you don't need to visualize the vocal cords when you insert the LMA because it just, remember what it's just closing. It's literally just right here, as opposed to the ET2 where it's right here.
Mm-hmm.
Yeah, right a couple of inches above the carina, but it goes through the vocal cords. Yeah, so it will go through that little upside down V. And this LMA just, so we don't. It's not an advanced airway. I mean, it is an airway, but it's not like an ET2. Okay, and so it's only short term because of where it's located, and you have a high risk for aspiration, and it's just meant to like in and out, you know. So usually, like if, let's say EMS intubates with an LMA, we'll switch it out with the tube exchange. Remember your bougie?
Mm-hmm.
So we would just take this. This would be off, and then we always use this end, and then we'd insert this in there, and then we take it off, and then we put our ET tube through there. So we'd exchange them. Okay?
For the skills, are we gonna do?
No.
Okay.
Yeah.
So it's
Just letting you guys know.
the three. Okay.
And then for the part that says oral suctioning, are we just gonna demonstrate that we're gonna?
Yeah. Just make
For
sure
each one.
anytime that you guys insert an airway, you should have a Yonker available to suction for any secretions above.
Okay.
Okay. All right. So I think I brought everything, but if I'm missing anything, I'll just make sure. All right. So we're gonna do suction, trach care, and suctioning. The first thing we're gonna do is we're gonna suction before we do trach care. And so some indications for suctioning would be like, coarse crackles, breath sounds, any type of obstruction due to, secretion. So if they sound clear, you don't need to suction them, okay? So hazards, what are some hazards with suctioning? Bleeding, hypoxemia, right? And
stenosis and stuff.
it kind of, your airway can kind of close up and spasm up. And complications, I mean, you can cause bleeding, you can cause trauma, all that stuff, okay? So the first thing you want to do is you want to hyperoxygenate your patient, right? So go ahead and get your ambu bag. And your ambu bag is connected to your flow meter, right? So our flow meters are over there, and you're gonna just turn it all the way up to 15, and then bag your patient, okay? And we're bagging from least 2 minutes, making sure that my SK curve. All right. And before everything, I like to check my suction pressure, okay? So you guys are bagging and you're watching your SpO2 and everything. So here, do you want to turn this on back here? And then you can hold it. And you guys can stop bagging with the SpO2. And then, do you guys remember your suction pressure for adults? Like 120 to 150? Okay. What you want to do is to check it, you could occlude it, and then just make sure that this one, what does it go to? It actually goes to 70, right? So it's not going to go too high, but just make sure you let me know 120 to 150, okay? But that's usually how we check it. There's a little dial where you can turn it, okay? I'm going to turn this on. Okay. So, now that we've hyperoxygenated, we've checked our suction pressure. Let me get another suction tubing. What I need you guys to do is I need you to perform sterile suctioning, right? So here is your sterile catheter. Here is your sterile catheter. And we're going to pretend that these gloves are, so these are going to be your sterile gloves, okay?
What size is that? What size is that one? Small.
So these are sterile?
Yeah. So you let me know what hand is your sterile hand, okay? And this is your suction catheter. Amy, this is your suction catheter that you're going to connect with. So that's your sterile hand, okay?
So when you go to alarms in PLC, you're gonna have the
Sterile.
temporary pressure. Essentially, what you're telling the machine is that the machine can keep going up to a pressure point. Or it's gonna say.
All right, when you guys are ready, go ahead and suction your patient. Okay. And make sure you maintain sterile technique the whole time. And you're gonna go all the way down until you feel resistance. And then you're gonna occlude suction as you pull out, not as you go in, okay? And then how long can you be down there for?
15 seconds.
Okay, so just make sure that you go down, you stop until you feel resistance, or sometimes they start coughing, and then you suction as you pull out, which is occluding that little pull on your suction cup. Okay? All right. I know that was technical dynamic. We need another one.
Right.
Styrofoam heads are.
Here, let's put the glove. This was gonna say. There's gloves
you
gonna
go.
hold his head.
Okay. All right. And so as you're suctioning, you guys are watching your patient, making sure you're watching SpO2, you're watching that there's no complications, and then you're looking at the secretion that you're suctioning. So what color are they? You know, how thick are they? Are they thin, thick, tenacious? Okay. Once you're done suctioning, you can go ahead and just toss your everything. Once you've completely, okay? Okay, so now we're going to do straight here, okay? And so, here's a couple of straight care kits. Use this sheet right there. Get all your stuff from your straight care. I'll show you guys. Oh, okay. So, get everything out from your trach care kit. Okay. Okay, so you should have gauze to clean the big surface areas. You should have a gauze to change. You should have pipe cleaners. You should have Q-tips or swabs, right? And what you're gonna do is you're gonna create your solutions, right? So you're gonna get sterile water. I like to have 2 sterile waters, but that's just me. So sterile water and then 50-50 sterile water hydrogen peroxide. Okay. So just make sure you guys verbalize that, like 50-50 sterile water. Okay, and then the 50-50 solution, so 50% hydrogen peroxide, 50% sterile water is what we're gonna use to clean everything. And then the sterile water is what we're gonna use to just wipe one last time to remove all that hydrogen peroxide. Okay? All right, and your inner cannula is gonna be non-disposable, so what does that mean? You have to clean it up. If it's disposable, then you can toss it and then replace it with a new one, okay? So if I tell you your inner cannula is disposable, you can go ahead and remove it and then clean it with sterile water, okay?
The volume's not set, okay, but our pressure is. So, patient, think of this basic settings.
And you just let it soak, or while you're doing the other
You
stuff?
can just get your little brush and then
Okay.
dip your brush in sterile water and then just clean it.
Okay,
Uh-huh. You can remove all the crud, and that's what the pipe cleaners are for, and your little brush.
okay.
Okay? And once you've cleaned it and it's kind of air dried it, you can put it back in.
Yeah, it's just like a smaller.
Oh,
Right, so if it gets harder,
It's just
those
harder.
lines,
I know.
the same pressure is not gonna be able to give the same volume. That's a concern for us, so they need pressure.
And when we
Yeah,
put,
it does such a
insert
thing.
it back in, it's sideways,
Oh, yeah.
or you do it from like, how do
Yeah,
you,
you
when
can
you
do
insert
it.
it?
When you insert it, I'll show you guys.
Okay.
Here's your little
I don't know.
inner cannula.
Do we insert it
After we're done, or
You can insert it after you're done. Just make sure that it's not like wet.
Okay.
That it's as dry as possible. And it's hard. Sometimes it might be like a drop, you
So
know?
after we're done with the whole cleaning or
After you're done cleaning it.
cleaning it? Okay, yeah.
Okay.
So after you're done cleaning it,
Yeah.
Okay,
then it dries, and then you can put it back
Yep.
in.
And then Natalie asked how you insert your inner cannula. Some people like to insert it kind of like sideways, and then they kind of just twist it as they go in, you know? But there's no like specific way.
okay,
And these are, you have to make sure that these lock in place. Because if they don't lock in place and they cough, it's gonna come out.
okay.
All right, so you've cleaned your non-disposable inner cannula. So now you can go ahead and do your trach here. So you're gonna remove the gauze, the old gauze that's there. Okay. And you're going